5 minutes.
Thank you, Madam Speaker. I rise to oppose the nonsensical pending amendment, the underlying bill, although the underlying bill doesn't really do all that, but most of all, to disagree with the remarks of the gentleman from Kentucky just now and from other remarks like that what the Republicans have done are not going to affect the people on Medicare now or the people who are older than 55 and older. What it does, in fact, is shift more and more of the cost of health care to people who cannot afford it, so that the richest Americans will not have to pay taxes. Will have to pay, they'll cut taxes for the richest Americans by even more, and they will protect insurance company profits and the profits of everyone else in the health care field who are making vulgar profits that are causing American health care to be twice as expensive as health care anywhere else in the developed world. The arguments and what the Republican Congress has done in these last few months have made very clear how cynically dishonest everything Republicans said about health care in the last 2 years really was, especially about Medicare. When Democrats really did try to find a way to get control of costs without affecting the quality, the availability of care, the access to care, the quality of care, all Republicans would say, even when it was specifically and narrowly targeted at fraud, they said that we were cutting Medicare. Now we see what they really think about Medicare. And now we see how little they really do understand how important Medicare is to the financial security of older Americans, of Americans in retirement. Now they say it will not affect you if you're over 55, if you're 55 or older. Well, I just turned 58. It's nice to know the Republicans care that much about me, but let me tell you, that's not the way it's going to work. Someone 53, just 5 years younger than I am, well, when I turn 65, I'll qualify for Medicare. Presumably I'll get Medicare. My 96-year-old mother, who I also did visit this weekend, she will get Medicare. I feel pretty confident she'll get Medicare for the rest of her life. But when I turn 65, I'll get Medicare. The guy who is 53 now, he'll be 60. He'll be paying taxes for my Medicare. He won't be getting it. He'll never get it. He'll never get it. What he'll get instead is a coupon, a voucher. He'll get an allowance to go buy private insurance. And private insurance is simply not going to pay for what Medicare pays for. It is going to be far more expensive. The Congressional Budget Office estimates that in just 10 years, those folks will have to pay 60% of their own health care cost if this plan goes through, what they call a path to prosperity, what should be called the path to insurance company profits. In 20 years, it will be 2/3 of their health care costs. They'll be paying for it. They'll also be paying taxes, or working Americans, people who are still in the workforce, will be paying taxes. So I get Medicare, and they know that's not the deal they're getting. The deal they'll be getting is that little voucher, that puny little voucher that puts them at the mercy of insurance companies. Now, Republicans thrive on resentment. All of Republican politics seems to be built around resentment. I don't want to have a nation that filled with resentment between generations. Ms. Edwards spoke just a moment ago about the contract between generations, that just as our parents took care of us in our childhood, we will take care of our parents and their generation when they retire. We'll take care of them with our Social Security taxes, our Medicare taxes. They will get those benefits. But under the Republican plan, the path to insurance company profits, they won't get Medicare. They'll get that little voucher. How long is that going to go on before that resentment builds up? How long is that going to go on before the people who are paying the taxes for it and know they'll never get it are going to say, no more of this. We have got to change this. Madam Speaker, what we want is for all Americans to get the same deal. We want the people who are 65, the people who are 96 to get the same deal, the people who are 70 to get the same deal, the people who are 58 to get the same deal, the people who are 50 and 30 to get the same deal. And if you are willing, if this Congress is willing to control cost, even though that means limiting the profits of some of the people who are getting really rich from our dysfunctional healthcare system, we can do that. I yield back.
Gentleman yields back. Gentleman from Rhode Island.
I move to strike the last word.